Hey, it's Dr. Bharat here from Oasis Dental. Started off this morning actually doing probably one of the most complex procedures in dentistry when it comes to aesthetics, and something that I find challenging, but something I also love. We ended up restoring a single front tooth using composite resin, trying to match it to look like the adjacent natural tooth. We also use a really unique technique this morning called Icon, which is a type of erosion resin infiltration, where we use a really low molecular weight resin. We pump it through the insides of the tooth there to change the optical properties of the tooth. So it's a really unique treatment that we can use for teeth that have white spots, different types of discolorations, and it's a really minimally invasive way of doing things. So that was a really great procedure this morning. We followed that up with restoring a single back tooth using our CEREC, so same day crown system, and we use a zirconium based ceramic material which is ultra strong, looks really nice, and fit really well as well. After that, we've just prepared two front teeth there for a set of veneers to go over the top of them. And our patient is now in his temporary veneers, and he'll be off to our ceramist to get a colour match done, a shade match done, and in a couple of weeks we'll be ready to fit those final restorations for him. So that was a pretty jam-packed morning. The final crown, and once we've done our design, we'll then be able to send it to our mill. The mill will take a block of ceramic, and there's lots of different types of ceramic that we can use based on the indication. Once we've done that, the actual mill itself will start taking that block down and creating the crown of our design, essentially what we're doing now. So it's pretty amazing how the actual software will then tell the mill exactly what it is that it needs to do with that ceramic block. All right, so that's all milled out. So next step is for us to get this out of the mill and then basically get to a point where we can fire it and sinter it to make it, or convert it to its final state where it's strong and aesthetic. And in the process of doing that, I'm also going to sort of paint it, make it look as real as I possibly can so it looks like an alive tooth. But that's the block there. And we've got our basic structure for our tooth. So let's go sandglaze it. It's because in this state here, it's quite soft, like soft enough for me to do this, like break it off the sprue like that. And then when I put it in the oven, that's when it becomes its final sort of strength and gets to its final state. So now we're just gonna give this a polish, make it all nice and smooth. That's all done for today. You did amazing. Have a very good rinse and be very careful whilst you're numb for the next few hours. But otherwise, all done, all back to brand new. Apart from that, you can eat and drink on it whenever you feel like it. Maybe just go a little bit more easy on it for the first 24 hours, but after that, treat it like a normal tooth and enjoy your brand new tooth. You did very well. It's all gone really well. Yeah, mate, your bite is intense. What I'm thinking is, what I'll do today is we'll do the preparation work and then I'll put some temporaries on today. Yeah. It'll give me a bit more time to then work on everything behind the scenes, just make sure everything's right, because otherwise I'll be rushing it to sort of get the colours. It won't fit today, but I'll put temporaries on today. You can actually literally see that sort of edge of where you're sort of grinding through that area there. Yeah. To put something stronger in there, it'd be, ceramic, and then, big smile again for me. Ceramic on that third one. I'd leave this one alone. I think that's fine. I don't think you should do 4, but 3 might give you a bit more security then. So leave the 4th one alone, but maybe 3. At least the 2 centrals and look symmetrical as well. And then the lateral ones. What are you thinking? The two middle ones? Do the 2 middle ones for sure. Oh, you were going to do this one and that one. Correct. So I definitely now, given that that's chipped as well, do the 2 middle ones. And then the one on the top left-hand side, up to you. Ceramic will be better, but if you wanted to sort of save a bit of money there, then just redo the resin on that one and see how it goes. Right. Benefit of this approach is then the 2 central incisors at least look completely symmetrical, and they're the strongest that they can be as a result of that. Okay, well, you're the boss, bro.